Start. Good afternoon. This is Dr. Bhupesh from Dr. BKM Institutes. Today is 10th of September. That is Friday, the last day of the week of our online coaching. And then we're going to start from Monday. The people who are having exam, wish them all the luck. And our contact number is +917696734256. So tomorrow is 11th of September and few people are having their exams. So wish them all the luck. And even the people who are preparing through our YouTube channel, wish you all the luck and hope you guys performed exceptionally well. Because at last, a teacher should be happy, whether from YouTube or from direct channels, that a person who is following you should pass. So that is what I wish for you. Thank you. And so let's go to the letter again. In the exam, suppose today is 11th of September and today is my exam. No matter what the letter is, I will start it from here. Write a letter to the Salisbury Community Health Nurse. So this I would write with the pencil in my hands that today my letter is for Community Health Nurse. So this I will remember in the complete letter so that I can select the data well. Community health nurse means that she is a nurse and she belongs to Salisbury Council community. So that means she belongs to a particular community center and she's a health nurse over there and she's a council nurse. Council nurse means is kind of a community system only, that they are the nurses who provide care. So second thing that you read after you realize that you are writing the letter to the nurse. जब आपको ये पता लग गया आप नर्स को लेटर लिख रहे हो तो आपको पर्पस चाहिए, पर्पस ऑफ द लेटर. So let's see what is the purpose of the letter. Contact social worker to arrange home visit for assessment of hygiene standards at home. So that means there are some problems with our home hygiene standards. Means when we will select the data in the social history, जब हम social history में data select करेंगे तब भी home hygiene की बात को समझेंगे कि home hygiene में ऐसी क्या दिक्कत थी. ठीक है, इसका मतलब वो अपने घर का ध्यान नहीं रखती थी. सोशल हिस्ट्री में ये बताना पड़ेगा वो अपने घर का ध्यान नहीं रखती. अरेंज फॉलो ऑफ अपॉइंटमेंट विद द लोकल जीपी फॉर द कॉलर बोन फ्रैक्चर. उसका कॉलर बोन फ्रैक्चर हुआ है तो लोकल जीपी के साथ अपॉइंटमेंट करनी है. यानी कम्युनिटी हेल्थ नर्स को, यानी काउंसिल नर्स को, काउंसिल क्या होता है, गवर्नमेंट बॉडी होती है जो एक्स्ट्रा सर्विसेज प्रोवाइड करती है. तो काउंसिल नर्स को अरेंज करना है सोशल वर्कर को. काउंसिल नर्स को ही लोकल जीपी से अपॉइंटमेंट फिक्स करवानी है कॉलर बोन फ्रैक्चर के लिए. पेशेंट टू बी सेल्ड टू द, चलो ये वाली रहने देते हैं. Department of Education or Children's Services need to be contacted for the assessment of children's safety. That means the patient is having two children, Braden and Taylor. So both the children should be assessed by the Department of Education. Psychologist needs to be contacted. That means patient is having psychological problems too. So medical history में से ये भी उठाना पड़ेगा. High protein diet to be followed. Burn marks and puncture wounds need to be dressed daily. That means there would be something about the wounds that should be dressed daily. Quit line for the smoking. So smoking would also be one of the factors that we will pick. Contact principal of Salisbury Primary School to explain the family and get report on the Braden's progress. So that means primary school को contact करके जो बड़े वाला baby है, Braden 6 years का baby है, उसकी performance को check करना है. That means mom को psychological problems है और वो अपने घर का भी ध्यान नहीं रखती है. इस कारण से that mom is having psychological problem and she is unable, mom means the patient is having psychological problem and also she does not keep the house clean and their kids and her kids are also are not well taken care of. So they need to be contacted with the Department of Education and Children's Safety. Also the principal of the school for the elder kid should be contacted to check the progress of the child and patient compliance with the medication of toxoplasmosis. This is the only topic of OET. This is the only letter of OET which is little tricky, and also in this word count will go around 230 words. So please do not panic even if you have written 240 words. Please do not panic. This kind of a letter will not come in the exam, but still, you know, it's a good discharge plan letter. Again, I will show you how to write the discharge plan. So first of all, you say, this topic is majorly about toxoplasmosis because in this, the major problem that patient is having is toxoplasmosis. That is why patient was admitted for 5 days. So the major topic is of toxoplasmosis. So what I will do first, when I would be writing, it would be greatly appreciated. Like yesterday also, I tell you how to write the discharge plan. First line is always, it would be greatly appreciated if you could. So that is where this letter starts from. So it would be greatly appreciated if you could survey the patient's compliance with the medication for toxoplasmosis. So that would be the first line because that's the main topic. If you could survey, this will go in the first form. So it would be if you could survey, same line, the patient's compliance with medication for toxoplasmosis, and also can arrange a social worker who can assess the hygiene standards in the home and can provide domiciliary care. So mix up all these things and make it as simple as you can. That is what I say. Make it as simple as you can. It would be greatly appreciated if you could survey the patient's compliance with medication for toxoplasmosis, and also अगर आपको ये बड़ा लग रहा है तो वहां पे फुल स्टॉप लगा के toxoplasmosis के फुल स्टॉप kindly. As usual, second line would be imperative. Kindly arrange a social worker who can assess the hygiene standards in the home and can provide domiciliary care. Further, second connector, further. नहीं तो along with this भी लिख सकते हो. Further, appointment words. This is an appointment. Any other appointment? Not really. So there is only one appointment and this appointment. So all right. So further appointment with local GP should be made. Make it simple. Should be fixed. अगर आपको made अच्छा नहीं लग रहा, further appointment should be fixed for collarbone fracture. And Department of Education and Children Services needs to be contacted for children's safety. Make it simple as much as you can. Don't worry, don't write anything complex. Please look at this, how simple it is. Then you will say along with this, psychologist needs to be contacted, should be contacted, needs to be contacted for assessment and therapy, and high protein diet should be followed. That's it. It is also important, that is the fifth way of writing. So it would be greatly appreciated if you could kindly passive voice, appointment with the local GP should be fixed, needs to be contacted, passive voice again. Then again two passive voice along with this, psychologist needs to be contacted, high protein diet should be followed. Then make it simple. Also it is important to arrange visit by quit line for quitting smoking, and bus done. If last line you have to write, please note principle of the elder child, but don't write this line, that's okay. So this one is sufficient. This would be the discharge plan. Then please listen to this recording 2-3 times, that how can you make a big discharge plan simple. Now always remember, when you are writing the community health nurse, don't over explain what happened in the hospital. This you don't have to explain too much. So community health nurse does not need information about the complex things you have done in the hospital. So we simply say, first paragraph, I'm writing this letter regarding Miss Harley, who is single mother of 2 children and is 6 months pregnant and was tested positively for toxoplasmosis. After treatment, her condition is better. So she is being discharged and now she is being referred to you for follow-up care. That's it. I will repeat it again. I'm writing this letter regarding this lady who is a single mother of 2 children and 6 months pregnant. She was tested positive for toxoplasmosis 5 days back. This is given wrong as 3 days or 5 days, whatever. In exam, this will not be the confusion. So don't worry, only one thing would be given. So don't get confused. So 5 days back, she was tested positively for toxoplasmosis and was admitted in the hospital. Now she is better. Yeah, now after treatment, she is better. So she is being discharged. However, she needs follow-up care hence is being referred to you, इसलिए आपके पास भेज रहे हैं। बड़ा सिंपल, फर्स्ट पैराग्राफ भी इजी हो गया, लास्ट पैराग्राफ भी। now you have almost 100 words to write middle paragraphs. Single you have already told. So Mrs. Harley is a victim of child abuse and maybe a heroin addict. Don't write everything. And maybe a heroin addict. But then again, social की बातों में हमें यहाँ पे स्मोकिंग छुड़वाने को कहा है, इसके अलावा कोई बात नहीं की, तो हम इसको रहने दे सकते हैं। मेन चीज ये लिखनी है, along with that, on 2 occasions, older children were removed. पैसिव वॉइस बनाना है, यानी कि गवर्नमेंट के द्वारा रिमूव कर दिए गए। older children were removed from her as her home was dirty. क्योंकि as का मतलब as her home was dirty। अब कनेक्टर से पहले कोमा, तो यहाँ पे कोमा। older children were removed from her as her home was dirty. Done. This line is complete. बॉयफ्रेंड के बारे में लास्ट में कुछ है नहीं। नेवर वर्क, पेशेंट हैज नो फैमिली टू असिस्ट हर। हाँ, ये वाली बात इंपॉर्टेंट नहीं है। बिसाइड्स मतलब जब भी आपको कनेक्टर समझ ना आए तब कनेक्टर एक आधी बार लगाना होता है बिसाइड्स। जब आपको कनेक्टर पता नहीं लग रहा, जब आपको बात को चेंज करना है, बिसाइड्स शी लिव्स विद न्यूमरस कैट्स। अदरवाइज अगेन दिस इज द ओनली लेटर in OET. Since last 7.5 years I have been teaching OET. This is the only letter जिसमें पता नहीं लगता कि ये न्यूमरस कैट वाला डाटा लिखना है, क्योंकि टॉक्सोप्लाज्मोसिस मेजरली कैट्स के कारण होता है। बट पेपर में ऐसा कभी नहीं आएगा। पेपर में हमेशा आपको बताया होगा कि ये बात इंपॉर्टेंट है। लेकिन ये बात मैं इसलिए बता रहा हूँ आपको, वैसे अगर बाय चांस आप नहीं भी लिखो तो कोई बात नहीं, पेपर में ऐसा नहीं आएगा। तो अगर आपने बाय चांस नहीं लिखा तो देयर इज नथिंग टू वरी। सो रोम वाज डर्टी। इसके अलावा लिख सकते हो बिसाइड्स शी इज अ हैवी स्मोकर। हमने बता दिया होम डर्टी है सब कुछ। बस इसके बाद जब ड्यूरिंग हॉस्पिटलाइजेशन लिखो, वहां पे आपको डाटा कंट्रोल करना सीखना है, क्योंकि आपको पता है आपका डिस्चार्ज प्लान बहुत बड़ा है, आप वो बना चुके हो। हमेशा पेपर में पहले डिस्चार्ज प्लान अपने मन में बना लेना है, तो आपको पता है वो बड़ा है। यू ऑलरेडी नो दैट डिस्चार्ज प्लान इज बिग एंड इन पेपर यू विल ऑलरेडी मेक इट इन योर विजुअलाइजेशन। आप अपने दिमाग में पहले ही बना लोगे डिस्चार्ज प्लान। सो ड्यूरिंग हॉस्पिटलाइजेशन छोटा करना है। ड्यूरिंग हॉस्पिटलाइजेशन the patient was aggressive and uncooperative. Also, she broke her collarbone due to aggression. ठीक है? So, treatment was given. Don't write too much. Treatment was given, and now she is better. वो बेटर हो गई। बस इतना लिखना है, इससे ज्यादा मत लिखो। अगर टॉक्सो एंड मेन बात है टॉक्सोप्लाज्मोसिस की मेडिकेशन। सो इसके बाद इस पेज को छोड़ के यहां से मेन चीज उठाओ। कंप्लेंट वाली बात भी इंपॉर्टेंट नहीं है, ये भी इंपॉर्टेंट नहीं है। टॉक्सोप्रिम मेन टॉपिक जो चल रहा है टॉक्सोप्रिम का, ये तो ये बहुत इंपॉर्टेंट है। अलोंग विद दैट टॉक्सोप्रिम was prescribed 4 times a day for toxoplasmosis। ये बात जरूर लिखिए। फिर जब नेक्स्ट पैराग्राफ बनेगा तो इट वुड बी ग्रेटली अप्रिशिएटेड इफ यू कुड सर्वे पेशेंट्स कंप्लायंस विद द मेडिकेशन फॉर टॉक्सोप्लाज्मोसिस। तो अपने आप फिट हो जाएगा। लास्ट लाइन यू हैव रिटन ऑफ टॉक्सोप्लाज्मोसिस की मेडिकेशन टॉक्सोप्रिम। So first line, it would be greatly appreciated if you could survey patients' compliance with the medication for toxoplasmosis. That is how you correlate the data. That is how you make a good writing. Please listen to this recording 2-3 times. This is a very boring letter, so I can understand. But please listen to this recording. Now I will take your questions. But I'm stopping the recording because I don't want this recording to be too big because it is already a boring letter. So this is Dr. Bhupesh from Dr. BKM Institute. Now I will take your doubts.